All right, good morning. This is Ray Walker with the Oklahoma Insurance Department. I'm the director for the Medicare Assistance Program, and glad everybody could join us today. This is the next webinar in our series. What have we done now? 5 or 6 of these? In the webinar series regarding Medicare and the different parts of Medicare. What are the different options that are available to people? And your speaker today is me. Talking about this topic. All of our other sessions so far have been speakers from other agencies. So far, they've all been from the Centers for Medicare and Medicaid Services. And wanted to remind you that next week on November 10th, we will actually have Jose Olivero from Social Security, who's going to be speaking on Social Security 101, just kind of the basics about Social Security. When do you need to sign up? How do you sign up? And all of that kind of stuff. That one, of course, it's going to be at 10 o'clock. All of them are at 10 o'clock. And then the following week, on November 17th, we're going to have Carmen Irwin from CMS, who's going to be doing a Welcome to Medicare seminar in Spanish. This will be the first year that we've done something like this. And we want to make sure that we are reaching everybody with important information about Medicare benefits. So that will be the first time that we've done that. And so if you know of someone who English is a second language for them that might benefit from this, please share that information with them. Point them to our website at oid.ok.gov so that they can get registered for this event. And we're hoping to have a really good turnout at that one. Wanted to remind everybody we are recording these events. So all of the ones we've had so far are available on our website at the same place you went to register. You can go on there and find that same area for the registration, and the link to the recordings is right next to that specific webinar. So if you want to listen to the webinar that was on the basics of Medicare or the one that was on the Part D drug plans, you can click that link and it'll take you directly to that recording. Wanted to let you know, as we go through the webinar today, if you do have any questions regarding what I'm covering, you'll be able, in the lower right-hand corner of your screen, you have a chat box, and you'll be able to enter your questions there, and we'll be monitoring those questions and taking a look at those at the end of the webinar, and we'll try to answer as many of those as we possibly can. So also one more reminder, we are in the middle of the open enrollment period. This is the time when we hope people are looking at their Medicare Advantage plans, their Part D prescription drug coverage. We want to make sure that people are on the best plan that's available for them for the year 2022. Just because your plan worked really well for you this year doesn't mean it's going to be the best option for you next year. So please give us a call at 1-800-763-2828 and let us work, go through your list of drugs and the pharmacy you want to use. It takes maybe 20 to 30 minutes to go through the process. And when we're done, if you don't want to change, that's fine. We're not selling any products. We don't get any commission or anything by getting you to change plans. We just want you to know what the options are that are available to you, and if maybe you can save some money for the coming year. A lot of the people that we counsel have saved significant amounts of money. Some people as much as $2,000 or $3,000 for the coming year, just by making sure they're on the right drug plan for them. Things can change, the dosage of the medications you take or the medications the doctor has prescribed for you. We know that there's been some changes on the Part D drug plans. Last year we had 30 different drug plans. This year we only have 23. So, there's going to be some changes there as well. So, make the phone call. Give us a chance to go through that process with you. It doesn't take that long, and it can save you some money. So without further ado, let's go ahead and get into the presentation for today, which is Medicare supplement policies. And if you will give me just a moment here to get things pulled up, thinking that I've got all of this stuff where I need it. And I'm going to move some things around here on my screen so that I'm able to see. We've got all this technology now, and one of which is having 2 screens on your computer. And for some people, that's really great. For some of us, that's almost dangerous. So let me see here I'm going to get this over here where I can see. There we go. All right, so today we're talking about Medicare supplement policies. and how they work and what the differences are and what kind of an option is this for you. So first, let's do a quick intro. Basically, there are two ways that people can get their Medicare. The first option you see here is good old original Medicare. That's Part A and Part B, the components of Medicare that started back in 1965. And the Part A is considered hospital coverage. Part B is kind of the outpatient coverage. And roughly that covers about 80% of your costs, your healthcare costs. The second option is Medicare Advantage plans, and they've been around for a long time now, just not as long as original Medicare. And they are just another option for a person to get their Medicare coverage. A person does not lose their Medicare if they get on a Medicare Advantage plan. It's just that original Medicare, instead of paying individual claims for that individual, they are paying, original Medicare is actually paying that Medicare Advantage plan to take care of the client's medical needs. So they're paying a set amount of money to that Medicare Advantage plan. And the costs associated with the Medicare Advantage plans are, it's a different cost structure. Instead of having a deductible and a co-insurance of 20% for everything, the Medicare Advantage plan can be structured somewhat differently. So in some situations, they can be very cost effective depending on the individual. There are pros and cons to both options. So that's one of the reasons why we were holding these webinars, is we want people to know what those options are so that they can decide for themselves which option is going to be best for them. One of the reasons why we're doing this is because where Medicare supplement policies are concerned, you can't have, there's no point in having a Medicare supplement policy if you're on a Medicare Advantage plan. They don't work together. So it's kind of a situation where you got to decide which option you want to go with before you get going on this stuff. Now, these Medigap policies are sold by private insurance companies, and as the name implies, they fill the gaps that are left over after original Medicare is paid. The things like the deductibles and the co-insurance and the co-payments that are left after original Medicare has paid. And all these plans that are available are standardized, and they are identified by a specific letter, which I know gets very confusing. We've already got Part A, Part B, and Part C of Medicare, and so it would have been nice if they'd have come up with something other than a letter to identify these different Medicare supplement plans, but unfortunately, that's what we're stuck with. So all of the plans that are designated with the same letter cover basically the same benefits. That's really the only difference in these plans, is the benefits can be a little bit different depending on which letter plan you're looking at. The big difference is going to be the cost. So a plan that has the same benefits that's sold by one carrier may have a significantly different cost than another one. So it's very much in the beneficiary's benefit to shop around to get the best deal. One of the things that we talk about with the Medigap policies is, keep in mind, they come in after Medicare has paid to cover those leftover portions of your healthcare costs. That means that if Medicare has paid that claim, the Medicare supplement policy really can't deny it. They don't have the option of coming in and saying, oh, we've reviewed this and it wasn't medically necessary or something like that. They're pretty much on the hook. So there's really not a lot of benefit to going with another company that may be more expensive for the same benefits. Now, you'll see on here where it says plans are different in Minnesota, Massachusetts, and Wisconsin. We don't need to worry about that because we're in Oklahoma, and as cold as it is here, we certainly don't want to go up there, so we're just going to focus on how the benefits work here. It's also important for people to understand that whether you're talking about Medicare supplement policies or Medicare Advantage plans, you do have to have both Medicare Part A and Part B of Medicare. So to help us understand exactly how Medigap policies work, let's talk a little bit about original Medicare and the benefits. First, we're going to talk about Part A, which a lot of times you'll hear it referred to as hospital coverage. As far as inpatient hospital care goes, the first thing that a person would pay who is on original Medicare when they go in the hospital is the Part A deductible, which for 2021 is $1,484. That's the first thing that they pay, and that covers them for the first 60 days of hospitalization for that benefit period. Starting day 61, that number goes up to $371 per day during that benefit period. And after day 90, that jumps up to $742 per day. Now, we don't see people who are admitted to the hospital for these lengths of stay very often anymore. But it's important for folks to understand what their out-of-pocket costs could look like. The same numbers pretty much stay in line if you're talking about mental health inpatient hospital stays as well. Skilled nursing facility care is also covered under Part A of Medicare, and you don't pay anything for days 1 through 20, but after day 20, that number goes up to $185.50 per day. Now that's for 2021. We don't know what these costs are going to look like for 2022 yet. So we're having to use this year's numbers. Home health care and hospice care are also covered under Part A, and the care itself doesn't cost anything, but there can be some associated costs, such as for durable medical equipment or certain prescriptions, respite care, things like that, that might have a cost associated with them that falls under Part A. As far as Part B goes, the deductible for Part B is $203 for 2021. Again, we don't know what it's going to be for 2022 yet. We've heard rumors that it could be like $217, but nothing's been announced officially. After a person has met the Part B deductible for the year, then the cost of their care, the benefits, their out-of-pocket is going to be roughly 20% of what's left over, whether we're talking about healthcare services or outpatient mental health services. There are some preventive services that are covered at 100%, and we certainly hope that people are going to take advantage of the, those preventive services. Then lastly on this slide, you'll see the Part B monthly premium. This year it was $148.50 per month. That's the standard premium. We have heard that there's been rumors that that's going to go up to $158.50 for 2022. But again, nothing official has been announced yet. So let's talk more specifically about the Medigap policies. Again, they're standardized plans that are identified by a letter, except for those states that are considered waiver states. And the plans with the same letter do have to offer all the same benefits. Now, companies don't have to sell all the same plans, and they don't have to sell them all in the same state. So a company may offer a plan A and a plan C and a plan G in Oklahoma, and they may offer different plans in other states. So it does vary by state as well as by company. The plans that are currently sold are plans A, B, C, D, F, G, K, L, M, and N. And I had a friend that told me many years ago that the way she remembered this is she came up with a boy called David flew green kites late Monday night. So I learned that and I thought, oh, that helps me keep them straight. Then I realized I put as much effort into learning that little saying as I would have if I had just memorized the letters. But anyway, now there are some other plans that used to be sold that are no longer available. Those are E, H, I, and J. Now, there are still some of those, or there could be still some of those that are out there. And those people that have those policies have continued paying those monthly premiums. So those plans would still be good. But we don't see very many of those. I think the last one of those that I saw was a Plan J. And the benefits of those plans are still good. They're still effective, but they're just not sold anymore. And as long as those people continue paying those monthly premiums, those plans will stay good. Now, Plan C and Plan F are no longer available to people who became eligible for Medicare on or after January 1st of 2020. And we've got a slide that's going to talk about that more in depth a little bit later. So here's a chart. And this chart, by the way, is actually, if you've got your Medicare and You handbook for 2022, these recently came out in the mail. This chart is on page 76 of that Medicare and You handbook. And so that's something you can, go back to and reference if you've got questions after the webinar. This chart is really handy because it shows you the different benefits that are available to be covered by a Medicare supplement plan. And you'll notice across the top of the chart are the letters that designate those standardized plans. So let's look, as an example, we're going to look at Plan A. It's considered the basic plan. And you'll notice that it's, so a lot of these cells have 100% in them. So for Plan A, it's going to cover 100% of the Part A co-insurance and hospital costs. So for those individuals, we said that there's a Part A deductible that covers the first 60 days. And then starting day 61, the individual is responsible for $371 per day. Well, this Medicare supplement policy would cover that, $371 per day. It also covers the Medicare Part B coinsurance and copayments. That means that after the individual has met their Part B deductible, then all that 20% that's left over for most services would be covered by their Medicare Supplement Plan A. And then you'll see that blood, as well as the Part A hospice care coinsurance, are also covered by this Plan A. Plan B looks a lot like Plan A, but it also adds the Part A deductible, which was $1,484, you may recall. So, for those individuals who want to make sure that they've got that covered, they may be more inclined to look at a Plan B instead of a Plan A. So as you go through here, you'll notice that different plans cover different benefits and at different levels. Plan F, as you can see, covers pretty much everything at 100%. It provides what's called first dollar coverage. That means that as long as the individual is paying their monthly premiums for their Plan F Medicare supplement policy, if they go to the doctor, the hospital, or whatever, they're not going to have any out-of-pocket costs because it's being covered by that Plan F. In addition, Plan F covers a few things that Medicare doesn't cover. You'll notice at the bottom of the chart, there is the second to bottom line says the Part B excess charges. What that's referencing is some doctors are considered participating providers for Medicare, and some doctors are considered non-participating providers. A participating provider is someone who has signed an agreement with Medicare to provide care to Medicare beneficiaries. They agree to bill Medicare directly and to accept the Medicare fee schedule as payment in full. A non-participating provider does not have to accept the Medicare fee schedule as payment in full. However, they are limited to charging 15% above the Medicare fee schedule. If someone has a Plan F or a Plan G MedSup policy, both of those policies cover 100% of that extra excess charge. Then the last line that you see on this chart is foreign travel emergency. Medicare itself does not cover you outside of the United States. However, if a person has any of the plans along the bottom row there that indicate so, those plans do offer some foreign travel emergency. And each one of those plans is going to have a limit based on the plan that's being sold. The next one that I wanted to touch base on is plans K and L. They're a little bit unique in that, as you'll notice, they may cover the Part B, things like the Part B coinsurance, but they'll cover it at 50% or 75%. Or they may cover the Part A deductible, but they'll cover it at 50% and 75%. At the bottom, you'll see that little box that talks about an out-of-pocket limit. And this is the limit for 2021. That means that as the person, once the person's out of pocket reaches those dollar amounts, then those policies would kick in at 100%. So it pays at 50% or 75% until their out of pocket reaches those dollar amounts at the bottom. And again, those dollar amounts will be adjusted for 2022. You will also notice, if you go back to the top of this chart, Plan F and Plan G have an asterisk next to them. That indicates that both of those policies are available in a high deductible option. So the high deductible option for those plans can be considerably cheaper, but they each have a deductible, which means that the beneficiary will pay for 2020, they would pay the first $2,370 of their portion of their care. Keep in mind, Medicare is going to pay just like Medicare always pays. They're going to pay their approximately 80% of the healthcare costs. But once the individual's out-of-pocket costs reach that $2,370 mark, and that was the number for 2020, then those benefits would kick in at 100%. So it sort of limits a person's out-of-pocket exposure for those plans. So again, this is a great place for a person to start shopping to see, what plan is going to be the right plan for them. And also keep in mind, the more you've got, the more benefits you get, probably the more expensive the plan is going to be. Now, here's the whole thing about the Plan C and Plan F. Back in like 2015, there was a law passed. It's MACRA. You probably heard people refer to MACRA before. And one of the components of MACRA was to limit people having first dollar coverage for their health care. There was a concern that people who had that first dollar coverage were possibly accessing healthcare services way more frequently than they needed to. So the idea was possibly if they could somehow build into this where a person actually had some costs associated with going to the doctor, they may be more inclined to not just go to the doctor for every little aching pain. So what they did and what the decision was that was made was anyone who became eligible for Medicare, they turned 65 on or after January 1st of 2020 or later, could not get a Plan C or a Plan F. They were no longer eligible to purchase one of those. Anyone who was eligible before January 1st of 2020 was still eligible to purchase a Plan C or F if the company was still offering those two plans. Also, anyone who has had currently a Plan C or a Plan F, they could keep those policies. They were still just as good as they were when the person purchased them before January 1st of 2020. So nobody lost their coverage. It's just that the new guys, the new kids on the block, couldn't get a Plan C or a Plan F. You'll notice that what those two plans have in common is the Part B deductible. That $203 for this year and the number that we think is going to be $217 for next year. So now everybody that starts on Medicare as of January 1st of last year would be responsible for the Part B deductible. So that was their solution to eliminating that first dollar coverage. Now, I wanted to point out again, anyone that's got a Plan C or a Plan F, they can keep that policy. It is guaranteed renewable. As long as they keep making their monthly premium payments, they're good to go. They don't have to worry about it. So, and this is the point that I just got through making. As long as you've got if you keep making your premium payments, you don't have to worry about it. It's still good coverage. So let's talk very quickly about buying a Medigap policy. Like, when's the best time to do this? And what are the factors that go into this? The cost of a Medigap policy can vary significantly, such as, are you in your Medigap open enrollment period, which we'll talk about shortly? How old were you when you started to purchase a policy? Were you just turning 65? Were you under 65? Were you turning 73? Maybe you decided to work longer and not retire so soon. Where do you live? Because sometimes where you live can impact the monthly premium for those policies. Also, as I said earlier, the company that you buy it from can make a big difference in how much your monthly premiums are going to be. Does that company offer any discounts, such as, on an earlier slide, we mentioned how you can't buy a Medicare supplement policy for a couple, so to speak, like a married couple. You can't have one policy for both people. Each individual person would have to have their own Medicare supplement policy. However, a lot of companies offer what they call a household discount, where if both family members are with the same company, they may offer them a discount on those policies. Was this person subject to medical underwriting? In other words, they didn't get enrolled during their Medigap open enrollment period or during a time when they have guarantee issue rights, which we'll talk about a little bit later. So they may have been subject to medical underwriting, where the company is able to go back and look at medical records and ask a bunch of questions, and they may rate the policy or even deny the person a policy based on that information. So many things can go into that. One of the areas that can impact the pricing of your Medigap policy is age. And there are certain ways that the Medigap companies can rate your Medigap policy. We're going to talk about those three ways right now. The first one we're going to talk about is no age rated, also called community rated. Basically, with this type of rating, everyone pays the same regardless of if they're age 65 or older. These policies may be a little more expensive in the beginning, but they tend to generally increase much, much more slowly, and they tend to be the least expensive over the lifetime of that Medigap policy. The next one we're going to talk about is issue age rated. These policies are based on the age, the price of these policies are based on the age when you purchase the policy. So they would probably be cheaper for someone who's buying that policy when they first turn 65 than for someone who's first purchasing at age 71. However, an issued age rated policy does not go up every year automatically as you get older. Now, the price can still go up. They could go up because of inflation and other factors, but it's not going to have that built-in increase that's based specifically on your age. The third rating type that we're going to talk about is attained age rating. These policies tend to be the cheapest when you first purchase them, but they do have a built-in increase that's going to be based on your age. In other words, these policies are going to go up every year as you get older. So they tend to be cheaper when you first buy the policy, but by the time you get into your 70, 75 or something, they can be more expensive. So it's something for a person to consider when they're purchasing their Medigap policy. Look at these rating types and decide which one makes the most sense for you. So when is the best time to buy a Medigap policy? The best time, and the first time a person has an opportunity to get a Medigap policy is what is called the 6-month Medigap open enrollment period. It's when a person turns 65 or older and they sign up for Medicare Part B. It's got to be both of those things. Once it starts, it can't be delayed and it can't be repeated. During that time, you've got very specific protections. A company has to sell you a plan if you're in your open enrollment period. That means they can't refuse to sell you a Medigap policy that they offer in that state. Also, they can't make you wait for coverage. And they can't charge you more because of any past or current health problems. It's the best time to get a really good deal on a Medicare supplement policy. So we encourage people, take advantage of that 6-month opportunity to get that policy when you don't have to worry about how healthy you are and all that stuff. So let's talk about this delaying Part B. People a lot of times are like, you mean why would I want to delay starting Part B? Because I need this healthcare coverage. Well, think about it. There's a lot of people who are working well past the age of 65, and some people who may not be working, their spouse is still working, and they may be covered under their spouse's group health insurance coverage. So if an individual has group health insurance coverage through active employment, whether it's theirs or their spouse's, they can actually delay starting their Medicare Part B. The reasons why they might want to do that is because their group health coverage is pretty much going to give them the same coverage that they might have under Part B of Medicare. So this gives them a chance to delay having to pay that Part B monthly premium, which we said was $148.50 in 2021, before they need it. If they're already paying for the group health insurance coverage, maybe they can delay and not have to pay for that Part B yet. The other reason why delaying is a good idea is because it puts off that Medigap open enrollment period, so that once they no longer have that group health insurance coverage, then they can enroll in Part B, and that starts that 6-month clock for getting the best deal on a Medicare supplement policy. A quick word about pre-existing conditions and Medigap policies. If a person has a healthcare condition for which they have been treated or diagnosed within the previous 6 months of the start date for their Medigap policy, a Medigap carrier can impose what's called a pre-existing condition clause. In other words, if it was something they were treated or diagnosed for in that previous 6 months, and that's called the look-back period, then the Medigap policy may say, well, we're not going to cover any of the costs associated with that particular diagnosis for that 6-month period. Now, after that 6-month period is over, the Medigap policy would cover the treatment for those conditions. Also keep in mind that during that pre-existing condition period, that 6-month period, Medicare is going to pay like Medicare always pays. This doesn't impact what Medicare pays. Another important point regarding that 6-month pre-existing condition period, if you had what is called creditable coverage during that 6-month period, for instance, if you had group health insurance coverage before that 6-month period, or you had another Medicare supplement policy or Medicare, if you had creditable coverage during that 6-month period, then the insurance company cannot impose that pre-existing condition clause. So you want to make sure, if you're going from group health insurance coverage directly to a Medigap policy, don't let more than 63 days pass before you get that policy, because then they can't impose that pre-existing condition clause for anything that was treated or diagnosed for the previous 6 months. Now, disability is treated differently in every state. There are no federal regulations related to how disability and Medigap policies work. Some states don't offer any options for people who are on Medicare due to disability. In Oklahoma, what our regulations say is any carrier that offers Medigap policies in the state of Oklahoma must offer at least one of the 10 standardized plans to individuals who are on Medicare due to disability in their 6-month open enrollment period. So that's in that first 6 months of when their Medicare starts. Now, this was covered in a different webinar. A person who is on Medicare due to disability, they have to have been on disability for 24 months before their Part B or their Medicare starts. Then after, in the 25th month, that's when they become eligible for Medicare. They can enroll in Part B, and that starts that 6-month clock. The company, the carrier, is the one that decides which of the 10 standardized plans they will make available to people in that circumstance. Also, they cannot charge more than the lowest aged rate for that standardized policy that they have identified. Now, outside of that 6-month open enrollment period, those companies can use medical underwriting, and they may or may not offer a Medigap policy to someone who is under age 65. So it's very important that people who are on Medicare due to disability take advantage of that opportunity if they can. Now, for those people who are on Medicare due to disability, we said that they would have one option, and the company decides which of those options is going to be available to them. When those people turn 65, they will get a whole new open enrollment period that lasts 6 months. And at that point in time, they have the option of getting any of the Medigap policies that are available in the state of Oklahoma. They cannot be charged more, and they cannot be denied a policy based on that any current or pre-existing health condition, including that disabling condition. So very important that people take advantage of that opportunity as well. So what are the steps of buying a Medigap policy? Well, first you need to decide what are the benefits you want. What are the things that are important to you to make sure that you've got covered? So, people will typically take stock of what their resources are, how much money they have in savings. Do they have money that they've got that they could use to pay some of those costs and keep the other money in a savings account that might be earning them some interest or something. Second, you want to find out which insurance companies sell that particular Medigap policy that they're interested in the state that they're in. And then the third step would be to get in touch with that insurance company, either through the company directly or through an insurance agent that sells the Medigap policy that they want to explore and compare the costs. Very, very important that people are comparing the costs of these policies. And then the last step is to actually purchase the policy. Now, the Medigap policies are required once you purchase. They do have to provide you with a copy of the policy in understandable language so that a person knows exactly what they are purchasing. Now, I want to make you aware, our program, the Medicare Assistance Program at the Oklahoma Insurance Department, we are a grant-funded program through the Administration for Community Living. And one of the tools that the Administration for Community Living has made available to us is what they refer to as a Medigap Plan Finder. What we do is we can take a person's age, gender, zip code, and whether or not they use tobacco products, and we can put this information into this tool, and we can generate a list that will produce a list of the Medigap policies that are available in the state and give you a quote of what those premiums would look like. It's a good starting point when a person is looking into getting a Medigap policy. We would also have to know which of the 10 standardized plans you're interested in looking at. Now, keeping in mind, if you're just now getting started on Medicare, you don't have 10 standardized plans to look at, you got 8. Because if you're just now getting started on Medicare, you do not have the option of getting Plan C or Plan F. So if a person is interested in getting this kind of information, you can call our phone number 1-800-763-2828, and we can run this comparison for you, and we can send it to you. We can send it in the mail. We can email it to you, whatever. However, once you get to the point to where you're ready to purchase that policy, we cannot sell you that policy. You're going to want to get in touch with the company that sells the policy. Once you identify the carrier you want to go with, you're going to either have to contact them or an agent. And whether, which one you go with is going to be your decision. Do you want to talk directly to the carrier, or do you want to have an agent, a local agent that you can go to if you have a problem or questions, or someone that you can discuss this with? So again, that's also a personal decision that each individual needs to make. We can give you, at our office, we can help you identify the phone number to reach out to the company, but we can't refer you to a specific agent. We're not allowed to, that would be kind of showing preferential treatment or something. So, you would have to find an agent. But to do that, the best way to do it is to contact the carrier and ask them, who are the agents in my area that sell this particular policy? Okay, so is there a reason why a person might want to switch their Medigap policy? They bought one, but they're thinking about changing. Why? Well, maybe they're paying for benefits that they don't need. Maybe a person, originally they enrolled in Plan F because they wanted to make sure they had everything taken care of. And now they're realizing, well, it's more expensive. Maybe I don't need this level of benefits. Maybe I could make do with less. Or maybe they need more benefits. Maybe they're like, I don't have the savings that I had before. Maybe I want to kind of fix my costs somewhat and would like to have a more robust benefit package. Maybe they just want to change their insurance company. Maybe they've had a bad experience with that company and they want to change, or maybe they've got a friend that's on a different insurance company. I've had that happen before. Everybody, I'm not sure that's the reason I would choose to change my insurance policy, but hey, it's their right. And a lot of times people want to find a cheaper policy. As we get older, our income doesn't necessarily go up anymore. And so people are looking for options that might be cost them less out of their pocket. If it's not during your Medigap open enrollment period, if it's not during that first 6 months after you've started Medicare and enrolled in Part B, or it's not one of the other times when you've got guarantee issue periods, it might be kind of tricky to switch a Medigap policy. One, you may wind up paying more for your new policy because they might be engaging in medical underwriting. In other words, if you're outside of that 6-month open enrollment period, the carriers do have the right to ask you questions about your health, to request medical records. They can review that information and establish your rates or even deny you a policy based on that information. Also, you might have a delay in your coverage because of that pre-existing condition clause that we talked about on one of the earlier slides, which could delay coverage for a specific condition for up to 6 months. So it's something that a person really wants to consider before they take action on getting a different Medicare supplement policy. And I think I went too far. You do have the right, under federal law to switch during your Medigap open enrollment period, as well as if you have a guarantee issue right. And we've got some slides coming up that talk about those guarantee issue rights circumstances. Also, you have the right to get a Medigap policy anytime an insurance carrier is willing to sell you one. You don't have to do it during a certain time of year like you do with a Medicare Advantage plan or a Part D prescription drug plan. You can buy it at any point in time, provided the carrier is willing to sell you one. When you do buy a Medigap policy, let's say you're on a Medigap policy and you're deciding you want to switch to a different one, you'll have what's called a 30-day free look period. And it's recommended that during that 30-day period, you go ahead and pay your premiums for both Medigap policies, the one you're leaving, as well as the one you're going to. This is a time period for you to review both policies again very, very closely before you turn loose of that old policy. During that 30-day free look period, if you change your mind and you don't want the new policy, you can cancel it. If you change your mind, or if you don't change your mind and you say, yeah, I want to move forward with the new policy, then you can cancel your old policy. But you would be required to pay the monthly premium for both policies for that month for that to occur. So let's talk about the rights and protections that a person has with Medigap policies. There are certain federal protections that are in place in certain situations. During these times, companies must sell you a Medigap policy. All pre-existing conditions must be covered, and they can't charge you more because of those conditions. However, for these guarantee issue rights to apply, a person does have to apply within 63 days of when that previous coverage ended. So let's look at that. Here's some examples. John is in a Medicare Advantage plan. He will have a Medigap guaranteed issue right if, the first one here, let's say that John joined a Medicare Advantage plan right when he first became eligible for Part A when he turned 65. And boom, immediately enrolled in a Medicare Advantage plan. But within the first year, within that first 12 months, he decides, you know what, I don't want this. I want to go back to original Medicare. He can do that, and he can pick up a Part D prescription drug plan, and he will have the opportunity to purchase a Medicare supplement plan with guarantee issue rights. The next example is, let's say he's on a Medicare Advantage plan, regardless of whether he enrolled when he first turned 65 or it was later, but his plan leaves Medicare. They just up and quit offering Medicare Advantage plans. He would have guarantee issue rights for 63 days to get a Medicare supplement policy. The other example is, let's say that his Medicare Advantage plan stops giving care in his area. And we had this has occurred this year. We've had some Medicare Advantage plans that have pulled out of certain zip codes. Those individuals do have guarantee issue rights to purchase a Medicare supplement policy. And then lastly, if John were to move out of his planned service area, let's say he's living in Tulsa, but he's decided to move closer to his kids in California, John would have the opportunity, he would have guarantee issue rights to get a Medicare supplement policy. Here's our next example. Mary has original Medicare. She'll have a Medigap guarantee issue right if, let's say Mary is on group health coverage, like from an employer or a union. This would also apply, let's say that Mary had retiree coverage through her employer, and that coverage ends. So if it's group health insurance coverage, then maybe Mary resigned or Mary retired. So her group health coverage is no longer available to her. She would have an option. She would have guarantee issue rights to get a Medigap policy for 63 days. The example that I gave a second ago about if we've had, unfortunately, some employer groups have ceased to offer group health insurance cover or retiree health benefits to their retirees. Those people would also have that guarantee issue right for 63 days. Now, this slide mentions the Medicare Select policies. And I didn't really go over those because we just don't do much with the Select policies. A Medicare Select policy is a Medigap product that is focused specifically on a certain network. It might be on a certain hospital network, like let's say Integris, or something like that, or a group of physicians. And so if you go to that network of providers, you're going to save some money. There are a few Select policies in Oklahoma, but we just don't run into this. For one thing, I think they're so similar to the Medicare Advantage plans, people don't really understand why they would go this route if they could go the Advantage route as well. So okay, guaranteed renewable policies. Any policies that were purchased after 1992 are guaranteed renewable. That means that insurance company cannot drop them unless one of the following happens. One, they stop paying their premiums. You got to pay your monthly premiums if you want to keep your policy. Now, if you also aren't truthful on your Medigap policy, they can drop you for that as well. That's one of the reasons why we always tell people, don't hide anything, be upfront, share everything, because you don't want to be in a situation where you could be kicked off. The last one is if the insurance company goes bankrupt or is insolvent. There are some circumstances when an individual might have the right to suspend their Medigap policy. One of those is if a person has Medicaid. Now, if a person is already on Medicare and Medicaid, there's really no reason for them to get a Medigap policy. Medicare and Medicaid are going to cover the majority of their costs, the vast majority of their costs. In fact, in a lot of areas, it's illegal for an agent to sell someone who they know is on Medicare and Medicaid. We refer to those people as dual eligibles. It's illegal for them to sell someone who's a dual a Medigap policy. But some people have a Medigap policy and then become eligible for Medicaid. For those individuals, they can suspend their Medigap policy for up to 2 years as long as they notify the company within 90 days of getting Medicaid. And during that time period, hang on just a second, I lost my mouse just left the desk. And then during that 2-year period, at any point in time, they can start it back up again if they need to. Why might this be? When they suspend their Medigap policy, they don't pay any monthly premiums for that Medigap policy. At the same time, the Medigap policy isn't going to pay any benefits. They're not going to pay any claims. They're going to leave that to Medicare and Medicaid. So, it's an opportunity for someone to, we talked about how people who are on Medicare due to disability or other reasons like that, we don't want someone to be in a position where they might suddenly now be subject to that underwriting, where a carrier would start looking at their medical record or something like that and be able to deny them a policy or charge them more. So if they suspend their policy, they don't have to worry about going through that process. Now, there are some circumstances where a person who does have Medicare and Medicaid might not want to suspend their policy. For example, there are some providers who do not accept Medicaid. And if that person is seeing a provider who is one of those who doesn't accept Medicaid, they may want to keep their Medigap policy so they can keep seeing that specific provider or hospital or whatever. Now, for people who are under the age of 65 who have a Medigap policy, they too can suspend their Medigap policy if they or their spouse has group health insurance through an employer. And that does happen from time to time. If they find themselves in a situation, their spouse has gotten a job and now they've got group health insurance coverage, they can actually notify the carrier within 90 days and say they want to suspend their Medigap policy. And there's no time limit on this. It can stay suspended for as long as they've got that employer coverage. And then within 90 days of losing that employer plan, they can reactivate it. So let's go through a couple of scenarios here. Ted is 64. He has had Medicare for 4 years due to a disability. He lives in a state that requires insurance companies to offer a Medigap policy to people with Medicare who are under 65. He currently has a Medigap policy. What might change when Ted turns 65 next year? So he's 64. He's been on Medicare for 4 years, so he's had a disability for a while. Now he's getting ready to turn 65. What's going to change? Well, for one thing, he's going to get another Medigap open enrollment period, which means he's going to have a wider choice of Medigap policies. Where previously he may have only had the option of Plan A or Plan B, he's now going to have the ability to get any policy that's available to him. He can't be charged more or denied because of his disability or any other health-related issue. Now we're going to talk about Sophie. She's 67 and healthy. She retired last month and she ended her employer-sponsored health coverage. She enrolled in Medicare Part A and she just enrolled in Part B. She's interested in getting a Medigap policy to help her cover her out-of-pocket costs. So what does Sophie need to consider? So Sophie should consider when she's getting this Medigap policy. The best time is going to be that 6-month period right after she lost her employer coverage and she started her Part B. She's going to have those guarantee issue rights that we talked about. She can't be denied. She can't be charged more. She also won't have that 6-month pre-existing condition clause so long as she doesn't go more than 63 days without that coverage. So here's an overview of the key points from the presentation today. You got to have Part A and Part B to get a MedSup policy. You still pay your Part B monthly premium. You will also have a monthly premium for Medigap. The best time to buy that policy is during that Medigap open enrollment period, the 6 months right after you start your Part B. And a Medigap policy can only cover one person. You can't get one for a married couple. Each standardized Medigap policy offers the same basic benefits, no matter which insurance company sells it. And costs do vary by plan as well as by company that's selling these policies. And in general, Medigap policies can only cover costs associated with services that are covered by Original Medicare. There are a few options that might cover that, the excess charges or the foreign travel emergency, but by and large, they only cover things that are covered by Original Medicare. Medigap policies do not work with Medicare Advantage plans, so there's no point in having one of each. And lastly, the big point, insurance companies are prohibited from selling Plan C and Plan F to newly eligible people who became eligible for Medicare on January 1st or later. So that is the end of that. I am now going to turn my camera back on. and stop sharing. I want to go quickly through our questions. We had a bunch. Okay, the first question that was there was the one about Plan C and Plan F. I hope I answered your question. Those were, uh, uh, the people who currently have a Plan C or a Plan F, or people who became eligible for Medicare before January 1st, 2020, they actually do still have access to those plans. It's just the new kids that can't. The next question, is there a difference in a copayment and a coinsurance, or are these words the same thing? Great question. A copayment typically refers to a set dollar amount, like $15, $25, $50. Coinsurance refers to a percentage. So a coinsurance might be at 10%, you're responsible for 10% of the costs, or 20% of the cost, or something like that. Next. Is the Medigap information you are providing for those who are already on Medicare and renewing for the 2022 coverage year? The information in the presentation for today was based on 2021. That's because most of the 2022 numbers have not come out yet. I checked this morning. We still don't know what the Part B monthly premium or the Part B deductible or most of those other costs are going to be for the coming year. So most of what I was talking about was using 2021 numbers. However, they will apply in terms of the framework for next year. I'm sure there will be a big announcement once they do come out with the Part B information. Next question, if you're on Plan N and then decide to switch to G later, are there any problems? Yes, if you are outside of that 6-month open enrollment period, they can underwrite that policy. They can ask you a bunch of health questions. They can ask for medical records. They can look into this stuff, and it could very well be you might have trouble getting a policy. That being said, if you're in relatively good health, you may not have a problem. There are a lot of people who are outside of that open enrollment period who are very successful in getting a different policy if they want to. However, if you do have some health challenges, if you've been diagnosed with cancer, if you've got heart problems or something like that, once that diagnosis is there, it can sometimes be a challenge to get a Medicare supplement policy. So the thing that we tell people is don't ever cancel your current coverage until you know for a fact you've got other coverage that you can go to. In other words, if you're switching to a different Medicare supplement policy, do not cancel your old coverage until you've got your new policy in your hands. Because if something goes wrong and you've already canceled your old coverage, you probably will not be able to get it back. Okay, next question. Should you apply for Part B during open enrollment if you have current health insurance coverage, but it will expire during mid-year when you retire? Or if you retire mid-year, will that be considered an event for open enrollment? Great question. Yes, if you're still working and you've got group health insurance coverage through your employer, you can actually, hold off until you're losing that group health insurance coverage, start your Part B, and what you're going to want to do is about 3 months before the month in which you're going to retire, get in touch with Social Security. That's the people you're going to call to get enrolled in Part B. Or you can go to the Social Security website to sign up for Part B as well. About 3 months before that month, contact them, start the process of getting enrolled in Part B, and if you'd like to be shopping for a Med Sup policy, great time to get started on that process as well. So that's when you would do that. Now also keep in mind, if you're eligible for Medicare and you have group health insurance coverage through your employer or maybe your spouse's employment, you can start your Part B at any point in time while you're covered by that group health insurance coverage. You don't have to wait until you lose that group health insurance coverage, but that's the way most people do. Okay. Can the supplemental policy be suspended if enrolling in a Medicare Advantage plan? Here's how that would work. Let's say that you're on a Medicare supplement, and thank you so much for asking this question, because I did not notice that the presentation that we used was the CMS model presentation. Let's say that you're on a Medicare supplement policy, that you never got on a Medicare Advantage plan. You are on a MedSup policy and you decide, well, maybe I'll try a Medicare Advantage plan. I just want to see what it's like. So you disenroll from your Medicare supplement policy and you enroll in a Medicare Advantage plan. You have 12 months to try out that Medicare Advantage plan. If during that 12 months you decide you don't like it and you want to go back, you can disenroll from the Medicare Advantage plan and you can get your old Medicare supplement policy back. That's what you can do during that 12-month period. But you can't have been on a Medicare Advantage plan prior to that. Okay, it's only if you're just trying out an MA plan for the first time. Now, if your old Medicare supplement plan is no longer available, you do have other Medicare supplement options that would be made available to you if your plan isn't sold anymore. Thank you so much for asking that question. Someone asked about the previous webinars being available to be viewed. Yes, if you go to our website at oid.ok.gov and you go to the same place where you registered for this webinar, those titles of those webinars is still listed, and on the right you're going to see a button for viewing the past webinars. Can we access the original presentations in the PDF format? You know, I don't know. All of these webinars are on the CMS.gov website. So I imagine you can get to the presentations there. And then next question, does enrollment in a new Medigap automatically kick the enrollee off the plan they were already enrolled in? I've never had this question before, but boy, is that a good question. You know, when you're talking about Medicare Advantage plans, the HMOs and the PPOs, the plans like that, we stress that the process of enrolling in a new plan terminates your enrollment in your old coverage. That is not the case with Medicare supplement insurance. You actually have to contact your old insurance carrier to disenroll from that Medigap policy. So excellent question. Thank you so much for asking that. Okay, that was the last question, and we are out of time. Thank you guys so much for joining us. I hope you found this information helpful. If you do have any additional questions, don't hesitate to give us a call. Again, 1-800-763-2828. We'd be happy to answer those questions for you. Remember, next Wednesday on the 10th, Jose Oliveira will be here to talk to us about Social Security, so please join us for that one. Don't forget that it's open enrollment. We'd love to review your Part D drug plan or talk to you about Medicare Advantage plans or anything other questions that you've got. You can call us at our phone number, or you can send us an email at map@oid.ok.gov. So thank you guys for joining us and hope you have a great day.